Tēnā koutou katoa, ko Nicki Williams tōku ingoa. It's a pleasure to be here today to talk to you about walking while female. Oh, was that? No. Yep. So today I'm going to go through why applying a female lens to transport and planning and design matters, data and what it shows us about our daily travel patterns, how these factors impact on women and girls walking, and a summary of these key issues. So the design of our towns and cities plays a large part in how we live our daily lives. Urban design impacts on who is enabled and who is disabled, who feels welcome and who feels excluded, who can move around freely and easily, and how that movement occurs. When it comes to planning and design, we're becoming better at considering cultural and accessible needs. However, it's well established that people of different genders have different needs. These differing needs arise because of different work and travel patterns, sense of safety, activities, and caregiver roles. For example, the image on this slide here shows a two-parent household where one works full-time and the other works part-time, as well as undertaking the unpaid household tasks. Anyone with children will probably recognise this scenario. And as you can see, the daily movements and activities are very different, and when transport systems don't take these differences into account, it makes people's lives harder. As urbanist and activist Jane Jacobs put it, cities have the capability of providing something for everyone, only because and only when they are created by everybody. Traditionally, urban and transport planning and design was undertaken by men, and this has produced cities that work best for those who work full-time, have adequate disposable income, and no unpaid caregiving roles. These decisions were not intentional, but just occurred because diverse needs weren't considered. To address the balance, we need to start applying a female lens to the work that we do. This means intentionally analysing the potential impacts of actions and decisions on girls and women. So despite the large volume of research that's already been undertaken about women in transport, the majority of this research tends to look at women as a homogenous group. However, things like income levels, ethnicity, age and disability all impact on women's travel. As such, I'm specifically focusing my research on the experiences of women from diverse backgrounds and circumstances. As part of this research, I've interviewed a range of women about their travel experiences and interviewed transport sector professionals about their understanding of this group's travel needs. The intention of my research is to generate new insights about the travel experiences for women and to understand why existing research has had such little impact on the built environment. I'm still at the analysis stage of my research, and as such, the information I'm sharing with you today comes from existing literature on women and walking. I will also share quotes from some of my interview participants that illustrate the challenges that girls and women face. I don't have the solution to these challenges, but I hope that the presentation today will highlight some of the issues that need consideration. So in New Zealand, 69% of female work is unpaid, and only 40% of women work full-time in Christchurch. Unpaid work includes looking after sick and elderly relatives, looking after children, and managing the household. There is a greater burden on caregivers if their children can't get to school on their own, or if elderly relatives don't have safe and easy access to nearby facilities. The less independent these groups are, the more unpaid care work is required. The significance of this is that women have less discretionary income. This impacts on travel mode options, level of independence, and ability to save for their retirement, thereby further reducing their independence later in life. Fear of violence is a significant barrier to women's mobility. This fear is reinforced by the ongoing experiences of harassment and intimidation experienced by women, which signals to women that they are under threat and do not belong in the public realm. This fear impacts on their free movement. Only half of females in Christchurch feel safe walking in their own neighbourhoods after dark. This isn't surprising when you consider that 35% of women have experienced sexual assault, and nearly 3/4 of women surveyed in a 2020 study had experienced harassment while on public transport or in public spaces. Despite these fears, women are more likely than men to walk for transport purposes. Walking is also a factor when it comes to accessing public transport. So the placement of bus stops can have a significant impact on the amount of walking required and therefore the ability to make use of this service. This diagram that we saw earlier shows the difference between linear travel and trip chaining travel patterns. Trip chaining becomes even more difficult for those where walking is their main mode of transport. And in Christchurch, 44% of households have only one or no car. So prior to the Industrial Revolution and expansion of car ownership, cities needed to be walkable, with jobs, shops, open spaces, schools and homes in close proximity. Zoning practices changed this pattern by separating activities into different locations around the city, cities that have been designed for travel by car. For those who can't afford a vehicle or who are unable to drive one, accessing services and amenities takes more time and energy, and the range of services and amenities that can be accessed is limited or expensive to access. Women I spoke to as part of my research had the following to say about their experiences. Mum will come in and take me grocery shopping, or if I can't manage that, like I'll order online, but it does become quite a bit more expensive ordering online. Sometimes even raining like this, really heavy rain, they need to go to the GP not far from their house. They'll normally walk, but they need to go, in the rain. The pharmacy is a bit of we'd have to catch the bus to Shirley and then walk to the chemist and then walk back to the bus stop. So it's quite a wee way away for that one. And while we might think of safety being primarily a nighttime concern, safety during the day is a significant factor for women. This can result from past experiences, feeling unsafe in our neighbourhoods, traffic volumes and the behaviour of other people. So this can be a particular issue for women with low incomes who are more likely to live in unsafe neighbourhoods or have limited transport options. There'd be places I wouldn't walk during the day, but that's all part of, my initial accident was being assaulted, so there's a bit of that coming into it as well. I actually have a little alarm thing, so I quite often carry that with my hand when I'm out walking and stuff. Sometimes suddenly we need something. There's a dairy over there. I'm not feeling safe to go there. When it comes to walking at night, this fear increases. For women who don't have access to a car, they engage in safety strategies, such as changing their route home, taking a longer but safer route to a destination, or using headphones or a phone to discourage engagement. The last couple of times I found myself getting off at the bus stop near the supermarket rather than the stop here. Yeah, because I think it feels safer to walk home down that way where there's more houses around. I find myself with my hand in my pocket where I've got the keys, that kind of thing, gripping the keys. As soon as we turned the corner, they just came up behind us. I wasn't super injured or anything, but it was pretty scary. Feelings of safety can be experienced differently by Māori women and women of ethnic minorities. Experiences of racism can result in increased feelings of vulnerability and heightened visibility. For example, a New Zealand study found that 40% of Māori women felt unsafe waiting for the bus during the day, compared to 20% for all female respondents. Furthermore, Māori women are more likely to be walking with wider whānau due to higher levels of family responsibilities. This adds to the challenge of travelling by foot and is exacerbated by the disproportionate health burdens carried by Māori, which impacts on the level of care work required. And so I always freak out walking by myself, but it's fine. It's quite a busy area, so there's always eyes watching. And after the mosque shooting also, I don't feel safe by myself to go walking now. Some people say very expensive to bus, and actually they can walk. They need to help their family in their own country also. That's why they walk 2 hours, 3 hours to come to the school. As these first few slides have illustrated, women's mobility and freedom are often limited by fear, particularly when it comes to walking. These limitations prevent women from going out at night, living a full and meaningful life, and impacts their independence and social connections. There's a few other women that live here. I don't often see them walking about and stuff, whereas the guys are just constantly out walking around the place. I don't leave the house by myself at night time. I'm a bit of a homebody. This last one was said to me by a number of participants who had the least access to transport, and it makes me wonder if being a homebody is a symptom of limited transport rather than actually a personality trait. And walking with children comes with its own special set of challenges. Mothers with young children have the burden of negotiating public space with a pushchair, walking with children who struggle with the distances, and dealing with the unpredictable nature of children near busy roads. Walking with children takes significantly longer than walking independently. For example, a woman with a young child is likely only to walk about 240 metres in 15 minutes, compared to an able-bodied male walking alone can walk about a kilometre in the same time frame, which kind of makes you think about the 400-metre walk to a bus stop that was being talked about yesterday. This further impacts activities such as crossing roads, where the timing of signalised crossings may be too short for little legs. And when there are no safe crossing points, trying to find a large enough gap in the traffic can be challenging and at times even frightening. Because sometimes I need to carry the little one and the other one wants to bike to preschool. I need to say wait because kids, they don't have patience. I don't feel safe. I'm not feeling safe at all. She's only little. It's a big stretch to get from one side of the road to the other in the one go. Like, we've walked to the supermarket and it's so terrifying pushing a pram when there's busy roads. And you go through the car park and no one looks when they're in a car park. So it's just a bit terrifying. Walking is an important form of physical activity among the older population. However, a fear of falling can result in elderly people, particularly women, staying home. The condition of footpaths and having destinations to walk to has a considerable impact on the likelihood that older people will continue to walk and thereby maintain their mobility. Where mobility is limited, this can result in lost independence and social isolation. Walking too fast from a fear of holding up others can also be a factor in falling, and elderly women in particular feel intimidated by high volumes of cyclists, even when there is a separated cycleway. As I'm getting a bit older, I do have to watch my footing and things like that. We haven't been pranked yet by an e-scooter, but had a few near misses. Getting from the bus exchange to the gardens, pushing a wheelchair, is seriously hard work because of the footpaths. So by the time we get home again, I'm just a total wreck. The distance to a destination is a barrier when travelling by foot, particularly for the elderly or disabled, where long distances require a certain level of fitness, physical ability and spare time. Certain design elements also affect people with visual impairments, those with limited depth perception or neurological conditions. For example, contrasting paving surfaces can be read as a change in level or a hole. Lack of contrast between a grey bollard and a grey footpath can make the bollard invisible. And complicated environments with surface changes and lots of street furniture can be overwhelming. Because any change in colour, I don't know if it's a change in surface. It just takes more energy to decipher what it is I'm walking by. Even with the cane, you know, it almost draws my focus down when I should be focusing on my surroundings. But sometimes if I'm like really tired and I'm losing my concentration, I then start hitting into street furniture. Electric cars are just too quiet. The other day my cane actually got stuck under a car because I didn't hear them coming out of their driveway, which kind of says something about how much attention the driver was paying. The condition of footpaths and presence of barriers can prevent people with pushchairs or wheelchairs from being able to travel through an area. This requires an extra level of effort on top of the effort that's already experienced by women getting around day to day. It's not very well lit, so I wouldn't use that route at night. I'd go somewhere where there's more traffic so that if I fall out, someone's going to see me. The way that e-scooters are left lying around and across footpaths is just a total shambles. And frequently, I would like to chuck them in the creek. But I don't walk far anyway because I have a really bad back, and that's really kind of debilitating. On good days, I might walk a bit further. I feel like I make more decisions than everybody every day, but yeah, that's just the way it is, really. The ability for female children and teenagers to walk around independently is affected by the safety concerns of parents and in relation to the risk of violence as well as traffic concerns. Traffic volumes is one of the top reasons that parents give for driving their children to school rather than letting them walk or bike. However, driving children is more common in high-income areas. When it comes to travelling independently, parents are more likely to let boys go out on their own from an earlier age. This increases their independence and presence in public space, while girls remain dependent on others and more often in the private realm. So she was walking by herself to school, but after the gun shooting incident, my mum's not really too keen on her going by herself. So that's why I always update my dad. So I'm always like, I've just come off the alleyway, or I just entered the alleyway. She will walk to her activity from school, but I will go and pick her up because I won't let her walk home. Even though it's close, it's dark. Despite the challenges identified so far, active transport such as walking has the potential to improve well-being at the population level. The physical exercise of walking can result in improved health, improved mental health, and improved local and social connections. However, the current narrative around the positive effects of walking fails to recognise that for those who have no choice but to walk, it can be a source of both physical fatigue and stress. Furthermore, the lack of transport can damage health by limiting access to social activities, amenities, and services. People said, don't walk, this area is not that safe, so we don't do much walking. And that's why I had diabetes also, because no walking place. I just walk because it's what I do. I've always done it, but probably good for me, you know, fitness-wise and health-wise, because if I didn't have that, I'd probably be in trouble, you know. So in summary, as discussed, women tend to have lower incomes, greater safety concerns, and increased travel barriers due to factors such as care work, trip chaining, and urban zoning practices. These circumstances can result in women having limited transport options and therefore being more likely to need to walk for transport purposes. Women experience a number of challenges when walking which can prevent them from getting adequate physical activity, living a full life, and can make walking for transport both stressful and exhausting. These challenges include a lack of local services and amenities within walking distance to home, safety concerns day and night which can limit activities, experiences of racism which can increase feelings of fear and vulnerability, differing levels of family responsibilities and cultural norms, walking with children, particularly for long distances, fear of falling for elderly women, difficulty of managing the built environment for those with impairments, limits on independent travel for girls and teenagers, and the potential for negative health outcomes under these walking conditions. These challenges cross a range of scales, from wider societal issues right down to the details of curb design and bus stop locations. While I don't have the solution to all these challenges, they need addressing if we're going to achieve women's equity of access and participation in society. With greater environmental focus on walking and cycling, if these challenges aren't addressed, disadvantaged women in particular will continue to get left behind. Ngā mihi nui.